Do you have shoulder pain, shoulder stiffness, or shoulder impingement? You might be overlooking this tiny muscle, your lower trapezius. This muscle controls your entire shoulder blade stability and movement. And when this muscle is weak, it can lead to things like shoulder and neck pain, shoulder impingement, and even diagnoses like a rotator cuff tear or a labral tear. This small but mighty muscle is the key to your shoulder blade's movement, its stability, and excellent posture. Let's do a deep dive on the anatomy and function of this muscle so we can understand how to strengthen it. All right, so when we're looking at the anatomy and we add all the muscles onto our back here, what we have our upper trap up here, we have our middle trap, and then this is our lower trap down here. A lot of people have way too much overuse of their upper trap, and that main action of that upper trap is to elevate that shoulder. Whereas the lower trap actions to depress the shoulder blade. It also functions to retract the shoulder blade as well as upwardly rotate it in something called the scapular force couple. To learn more about that scapular force couple, go watch my video about upper back knots to understand what that is and how it functions with the lower traps. So like I said before, if we have so much upper trap usage where we get our ears coming upwards and we don't live in this depressed position, you can see where this lower trap becomes inactive, inhibited, and very inefficient. To determine if this muscle is weak, you can muscle test it. I do this on a lot of my patients, and about 99% of people in pain cannot even hold the resistance of gravity. So what we're gonna do here, we're first gonna test her middle traps here. So we're gonna take her arm. I'm essentially gonna set her shoulder blade for her so she can have that muscle in the most shortened position so it's easy for her to activate. Then from there, we're gonna extend that arm, we're gonna go thumb down, and we're gonna hold that nice and strong for me. Do not let me push you down. So we're testing her middle traps here so you can see she has a good amount of resistance right there. We also get a little bit of rhomboids with that one too. Now if we test that lower trap, I'm gonna put her into 135 degrees in a Y position with her thumb up. So that's the most activation of our low trap, so set that shoulder back. I'm gonna extend that arm, we're gonna go thumb up, and I want you to hold that nice and strong for me. So you can already see she's shaking in that position, but when I push her down, so that's the strength of that low trap. So definitely we have a little bit of weakness back here into those low traps. So let's talk about some strengthening. For my favorite exercise to focus on the activation and that mind-muscle connection of that lower trap is Y raises. So what I'm gonna have you do is you're gonna lay flat on the floor. We're gonna have our elbows up in that kind of position like we had, our hands nice and straight, thumbs up towards the ceiling. All I want you to do is I want you to do like what we did in that room, and I want you to raise both arms up straight. So you can see where if I ask someone to do this, you can relax there. If I ask someone to do this, she has so much upper trap usage already. She doesn't have that mind muscle connection to those low traps. So what we need to do, slow it down, focus on those motor programs in our brain, that mind muscle connection. So what I'm gonna have you do down here first is, I don't want you to just lift up straight, because what she's using is she's using her posterior deltoids when she's doing this, and those upper traps and rhomboids and middle traps. We want those low traps. So what I'm gonna have you do first is we're gonna depress our shoulder blade. So before you even lift those elbows and those hands off the ground, I want you to pull your shoulders back first. Fully depress them, and then now you're gonna lift up. So you're gonna lift up. So you can see it's a lot harder for her to do. And you're gonna hold that position. I want you to hold for 5 seconds. So 5, 4, 3, 2, 1, and then come back down. Every single rep I want you resetting. So go again. Don't even let these move yet. So all with the shoulder blades, there you go. And now lift, yep. And I want you to hold that 5, 4, 3, 2, 1. It's normal, you obviously want to be in that elbow extended position, but it's normal like her to be bent here first, and then eventually we can progress to our arms being straight. But that's our Y raises. Y raises are the most researched activation when it comes to lower traps. There we did on the floor, we did at end range. You can obviously see full range would be standing, something like that. I like to start out end range first and then slowly progress to that full range, because if someone just starts doing those Y raises, you are going to see again, like you saw with Lauren, she's going to use lots of her posterior deltoid and upper traps to perform that movement. So start on the ground, and then we progress to getting less horizontal and more vertical. So for that progression of the Y raise on the floor, next is up on the bench. So with the bench, the same concept applies. You're hanging your body, your head off the edge, you're depressing those shoulder blades first, and then you're lifting up and trying to reinforce and pull from those lower traps even more. Okay, on this one, you'll see a lot of times people will start with that depression, then they'll lose it and just trying to lift it up with it. So make sure you keep that depression, and then you're still trying to almost scoop and drop that shoulder as you come up and over it. You don't want to just lift up through those posterior deltoids. So drop those shoulders, keep keep pulling from those lower traps as you come all the way up. There are so many different variations to this Y raise. You can do like a Y raise press. On a hyperextension, doing Y raises. My favorite crossover band's doing Ys. You really can just get creative and be dynamic with that lower trap activation. For our next strengthening exercise, this is also a phenomenal rotator cuff strengthening exercise. So what we're gonna do is we're gonna have a light to medium resistance band and we're gonna put it around our wrists. Then from there, what we're doing is we're gonna set our shoulders, we're gonna take those Y raises and everything that we just did. I want that concept ingrained into your brain where you retract those shoulder blades down and back to start. And then what we're gonna do is we're gonna pull out against that band to give resistance, so using those deltoids. And then from there, we're just gonna lift our thumbs and we're gonna go up to the ceiling. So lifting those shoulders as we come up. Right about this 1/3 to 2/3 mark is what you wanna think about doing, is dropping those shoulders, so getting those low traps to kind of reinforce and drop and pull more as we bring our arms up overhead. Okay, what you don't want to see in this position is people start with this here and then they kind of lose it throughout and now you just have those upper traps working. This can be a very easy exercise if you're doing it incorrectly. So again, set those shoulders down and back, pull out against that band. Right about before you get to that 90-degree mark, you drop those shoulders and keep trying to pull from those lower traps even more while you keep those elbows nice and straight. Same thing on the way down, you're just keeping those nice and stabilized in the back there. You're not seeing so much forward translation of those shoulders as you're coming down. That's what you'll see if you're lost that low trap engagement on the way down, as those shoulders will now start to round. So keep that back as you come on the way back down. Next up, we've got a scapular pull-up. So this is a great depression exercise, focusing solely on that depression. So you're gonna get up into a pull-up position. And then from there, all we're doing is we're keeping our elbows straight. Your elbows are not gonna move at all during this entire time. Your elbows nice and loose, nice and lengthened, and all we're doing is just pulling up and then bring it back down. We're just depressing the shoulder blades as we bring it back down, holding nice and controlled, not allowing those elbows to start that motion. You want it to be all just shoulder blades retracting. You also want to make sure when you're in this, you're not letting your shoulders round and you're getting to this position. So keep your head back, keep that chest tallest point, and pull up like you want to start. A lot of times when people are doing pull-ups, they won't get this initial depression. You'll see them just muscle and pull up like this, but you need to start with that depression and then pull up with that pull-up. If pull-ups are too hard for you to hold your body weight, I also like doing this a cable variation. So step one, you're gonna bring these all the way to the top setting, and then next you're gonna take a seat on the floor. You wanna make sure in this position you're directly underneath and you're not back here like this. We want those directly, vertically underneath us, okay? Then from there, we're doing the same thing like we did on the pull-ups. We're just depressing through our shoulder blades and not starting with our elbows. So you don't wanna pull down through the elbow. This is not a lat pull down. This is the beginning of a lat pull down where we just pull down through the shoulders, bring it back up. I like this one too because it's weighted, so you can really track your weights and see if you can kind of progress and really build the strength within here. For our next one, it's depression dips. This is more an advanced version, but it's a very good version because if you think about those last ones, we're all starting in this upward position. So if we already have really tight upper traps, we're starting in that position, it's gonna be really hard to get out of it. So this, we're doing a depression dip. So you're gonna rise yourself up onto that bar. We're keeping our elbows locked out the entire time. We're just gonna sink our shoulder blades down and drive away, trying to pull through those low traps. Okay, just sink it down, drive away. Big mistake on this one is people will keep their shoulders rounded and they'll be in this position here. So again, keep your chest at highest, tallest position, and you're just depressing through those shoulders the entire time without letting your torso move. For the alternative, if that one is too hard, you can do a dip on a bench. So as you would normally do a dip here, we're keeping our elbows locked. You're just sinking your shoulder blades down, pushing away. This one's kind of a little bit easier to keep that chest the tallest position, but you still don't want to be down here in this position. So the head always follows those shoulders, so keep your head back and you're just depressing as you come up. Lastly, we need to talk about posture with the low traps. A majority of people have terrible posture, and a lot of it is because people struggle with the activation and strength of those low traps. Not only is this muscle a huge postural muscle, but it's also an endurance muscle. So knowing what not to do can go a long way. I'm sure all of us when we're kids were told to pull your shoulders back. So a lot of people will just go pull their shoulders back like this. And what that leads to us doing is leaving too much middle traps and rhomboids working, and we're not getting that depression. So what I want you to actually think about doing is not just pull your shoulder blades back, pull your your shoulder blades back and down. So you're trying to think about back and down. You're pulling from these low traps. So when it comes to posture, doing exercises like we've shown you is not enough. You need to have the awareness in your brain and your body throughout your everyday life. So what I tell people is pick activities that you do every day, whether it's driving, brushing your teeth, maybe sitting at a work desk, put a timer up there every 5 minutes on the hour, you attain perfect posture. Posture is not something that you can just remind yourself to fix. If you're ready to be accountable and fix that posture for the long run, I'd recommend trying my posture program. It includes lots of exercises and posture cues like we talked about today. It's linked below, or you can access it within my website to restore the body that you live in. Don't forget, new videos every Tuesday. If you were subscribed, you would know that.